Good morning, everyone, and thank you very much for coming this morning to hear our panel of experts, which we're delighted to have. The theme of today is mental health in an unequal world, and we're looking at the implications of mental health for underrepresented groups, such as barriers to treatment, services, education and government, and employment. And we also want to consider how future generations can encourage positive conversations relating to mental health and well-being, and the expectations of society and employers in working in this space. So I'll ask the panel to briefly introduce themselves. I'll go by my screen. Alexis, if you would mind introducing yourself. Oh, sorry, before I do that, and this is my mistake, I'd just like to give a quick visual descriptor of myself. I'm a very middle-aged woman with reddish blondie curly hair. I'm wearing a red scarf and a black top, and I've got glasses and I'm sitting in my kitchen. Sorry, Alexis, over to you.
Thanks, Jeanne. Hi, everybody. My name's Alexis Goldfarb. I am a white female with dark brown hair, and today I'm wearing a navy jumper. And by other way of introduction, I am Senior Diversity, Equity and Inclusion Consultant for Northern Trust EMEA, and as part of that, oversee the design and delivery of our entire mental health and wellbeing programme. Thanks.
Thank you. Ross, if I turn to you now.
Yeah, sure. Morning, everyone. My name is Ross. My visual descriptor is I am a white male. I'm wearing a white shirt and similar enough hair to Jeanne, curly red hair. I'm sat in my kitchen, but you can't see it because I have a lovely background on. My role is the Digital Services Coordinator, and I work in SpunOut, which is the National Youth Information website. We provide information to thousands of young people every year in Ireland. And my role focuses on working in the Youth Information Chat Service, which is a one-to-one service open online Monday to Friday, and it connects young people in with youth information officers.
Great, thank you for that, Ross. Shubhangi, if we turn to you now.
Hi everyone, I'm Shubhangi. My visual descriptor is that of a Indian, cis female presenting non-binary queer person who is currently wearing navy scrubs with a neon yellow stethoscope. I'm a doctor in James's Hospital. I'm an academic, and I'm also a trustee for Choice Support, which is a UK charity that specifically works to enhance autonomy and provide the best self-asserting quality of life for people with mental illness, neurodivergence, or other social challenges, and encourages supported living, supported employment, and supported relationship decision-making. I'm also currently a student on the Advanced Diploma in Medical Law in the King's Inns, and I'm hoping to duly qualify as a barrister and a psychiatrist.
Wow. Matt, if we turn to you now.
Great, thanks, Jeanne. Yep, so my name is Matt Cameron, and I'm the Global Managing Director of an organisation called LGBT Great. My visual descriptor, so I'm a white man with blonde hair, currently wearing a black polo and a blazer. I'm also originally from Blackpool in the Northwest, very much first in the family to go to university, also a member of the LGBT plus community, and my pronouns are he, him and his. And very quickly at LGBT Great, we focus on education, visibility and outreach programs for the global financial services industry. So really, really delighted to be here today.
Thank you very much. And thank you to all our panel for being here today. It's great to have your wisdom and your expertise on this issue. So without further ado, we might kick off. The first question I'd like to put to you all is, and I'll go to you all individually on this, mental health, youth mental health in groups such as the LGBT community is an ongoing issue, and the problems they're facing. So have you any experience of why these groups in particular are affected, and what are the learnings from them? And I might go to Ross first, if that's okay.
Gonna have to be okay, Jeanne. Yeah, so I suppose it's the issue of mental health is something that we see quite a lot in the Youth Information Chat service. And while people might not come to us necessarily to access mental health supports, because that's not our area of expertise, you can see how the issues that they're experiencing in their lives do really connect to their mental health experience or the potential for mental health issues. So it could be anything from not being able to secure a job, to losing a job, to their own illness, to illness within the family. And those kind of issues that can cause worry, can lead to anxiety, can lead to kind of more progressive and enduring issues. So with that, we try and answer the questions and give resolution to issues that young people might be experiencing, but also to empower them with the information to do what they need to do and what they think is right. For particular groups that are vulnerable to mental health issues, I suppose there has been, quite a lot of research in Ireland in particular around the different issues that vulnerable groups face. There was a really good piece of research back in 2015 by LGBT Ireland, which was probably the most comprehensive look at youth mental health with the focus on LGBTI young people. And, the outcomes of that were that issues around self-harm and stress, anxiety, and depression were significantly higher for LGBTI young people. And yeah, I guess, those groups, what am I trying to say? I suppose those groups probably face additional barriers or additional pressures in terms of their mental health because of the nature of vulnerable groups, how vulnerable groups are treated in Ireland, how we deal or don't deal with the issues that they face in particular. And that goes beyond stigma, but it includes the accessibility of mental health services or accessibility of social services, and the connectedness of social supports and social protection. So I suppose there's a whole host of issues and barriers that are experienced by vulnerable groups specifically, but also experienced by individuals in particular, and how difficult that can be and adds to their experience of the mental health issue.
Thank you. Thanks, Ross. That is really insightful. It is an issue. Shubhangi, do you have anything to add to that, particularly on youth LGBTI?
Yes, so I think it's actually really interesting to get Ross' perspective on this as somebody who operates a youth chat line, but not a youth mental health chat line. So I volunteered with Nightline, I volunteered with other crisis mental health services, and I want to work in building an Irish publicly accessible crisis mental health service. And I suppose what I see in terms of the demographic of people who access care, and I would like to preface this by saying I feel like people of all ages in the LGBTQ community face some of these issues, and people of all ages outside of the LGBTQ community additionally also face, issues of inclusion and exclusion that sometimes cross over the same lines. But I find from, I suppose, a clinical perspective, and also being somebody who's had lived experience of serious mental health issues and invisible disability, I think the problems, as Ross started to say, can be teased out into these extrinsic factors and extrinsic discrimination, but also to some degree intrinsic, not internalization per se, but how much of the outside people let in, whether that's just due to a natural disposition or how we are made to internalize our discrimination as an identity for ourselves. And I think there's two parts to tackle, I suppose, in terms of youth mental health. First comes from societal education, and then also, I suppose, individual education, interpersonal education, improving sexual health education and access to sexual health services for people of all genders and all identities. So I suppose on the social part, if we look at LGBTQ people, and particularly young LGBTQ people, you see that we are obviously under the same stressors as young people as anybody else, first relationships, first degrees, whatever, like moving out of the house, all of that. But in terms of vulnerability to mental illness, outside of, if we talk about the biopsychosocial model, outside of the biological part of it, people are more vulnerable because you are much less likely to have a core group of supports that is consistent as a young person when you're dealing with, whether you're dealing with familial estrangement, falling out with your friends, not being able to find community, finding spaces in the queer community that can, in fairness, be quite dangerous to you as a young person. if you don't have this locus of stability or this locus of an understanding of what healthy relationships might be like, because oftentimes we do face a lot of opprobrium, we do face a lot of estrangement for being queer from very, very young. So on the one side, you have this increase in social stressors plus a loss of stability very frequently for queer young people. And then on the inside, you have this constant pressure of how to present acceptably as a queer person, or how to, be out in the right way to fit into the right group. It's a really challenging time anyway for any young person in terms of forming your identity. But I think sometimes features of mental illness or prompts for mental illness can arise from the fact that your identity lacks a fundamental stability that sometimes non-queer people can have from their upbringing and from their community. But your identity is so dictated by presentation. It's so dictated by how you present to feel safe or how you present to be out in the right way, that you can kind of lose yourself or lose the ability to stand up for yourself in your own mind, to stand up for the things that you care about and the person that you want to be. And that in itself, people see being out or being queer as this end goal sometimes. Like, once you're out, it'll be fine, or once you've told your family, it'll be fine, or whatever. Whereas I suppose the journey of mental health and identity as a queer person, I find sometimes can be more healthily explored when people just have the agency to self-assert and acknowledge that being queer is an evolving process for them. I mean, I can only speak to my own experience, but I've certainly found it a lot more liberating just existing, and whether I contribute to media pieces or whatever, never ever letting myself be given another label beyond queer, or at discretion choosing to use pronouns or not choosing to use pronouns, because how I present to feel safe, to feel validated changes. And I've found that accepting that, or being in the right community, having the right education and resources to accept yourself as changing, rather than finding an identity and sticking with it to present for other people. I found that certainly helpful for my mental health. And sorry, I know I've been talking for quite a while. I think the only other thing that I want to highlight was particularly vulnerable groups in the LGBTQ community. I mean, statistically, this has been validated time and time again. Trans people are doubly or triply or quadruply harmed, or experience greater harms in the LGBTQ community. Bi people do as well, like bi and pan people. Obviously, being poly is not necessarily part of the LGBTQ spectrum, but in some ways they also experience, legal discrimination and societal discriminations. And I think those things require particular care, not just from general community, but also greater understanding in the LGBTQ community itself, to understand that often you experience an intersection of discriminations if you're trans and something else, or if you're bi and trans. And that it's not a zero-sum game. We've kind of evolved beyond the labels of, just say like the lesbian and gay spaces, or, the lesbian women's club, or the gay men's bars, or whatever. It does require a bit more education within the community, and a bit more acceptance to understand that people's identities are evolving, and in that evolution, they might experience greater harms.
That's a really good description, that it is an evolving journey, and it's not something you maybe think about overtly. You assume everyone is boxed off with their labels and this is you and you'll never change. And it's a really good thing to think about, because even just with the aging process, your sense of who you are and your identity changes radically over time. So that's a really good thing for everyone to consider, both within the community and without. So thank you for that, Shubhangi. Matt, I'll come to you on that question, if you can still remember it.
Yeah, I can, thank you.
Right.
I think just to build on some of the themes that my sort of co-panelists have been sort of talking about here, why are LGBT plus people particularly affected by poor mental health issues? And I think if we think about the environment at the moment in which we're operating in, as quite rightly some of the other panelists have pointed out, this is already a marginalised group, and the more sort of lenses you have to identity, the higher the probability actually that you are experiencing more social isolation and exclusion. We know the community faces big challenges around discrimination, homophobia, transphobia, social rejection, all of these sort of elements. And we know that there's also other inequalities as well around, disproportionality with regards to career opportunities, which is why your organisation is so important. Income differences as well. If we then add into the fact that we've obviously been through a pandemic, we've had an isolation where people have been forced into home environments where potentially they're not out. If we sort of take into consideration the political climate globally and the rise of anti-LGBT governments around the world, and then you look at the increase in sort of hate crimes as well. The British police actually reported this year a 3% increase in trans sort of hate crimes. The number of trans murders surpassed 2019's total in just 7 months. So we know that the environment is very, very difficult in many places. And this contributes to feelings and anxieties. And then as a final sort of thought really on this question, if we then look at the data points, think about the environment and the impact, the data points are telling us that, around about 50% of people at some point within their life will be diagnosed with a mental health condition. We've got 50% of LGBT people that have experienced depression, 3 in 5 anxiety. And then the point that we just talked about at the moment, look at the trans community, almost half of this community have thought or have attempted to take their own life. So we know that this is really, really playing out. And the learnings in the final part to your question there, I think the learnings are really clear for me. I think firstly, the data is clear. This is a group, this is a community that needs supporting. Secondly, global crises, whether it's economic, whether it's pandemics, have a disproportionate impact on marginalized people. And I think the third learn for me is that technology actually is an opportunity to reach and engage more people in some environments. So I think those would be my initial thoughts, Jeanne.
Thank you. Thanks for that, Matt. I'll actually broaden this out now to sort of consider what are the barriers for the general marginalised community to treatment and equality of services. What are you seeing in your work or in your workplaces? Alexis, maybe you might give some thought to this. What do you think stopping people from getting help or?
I think there's still a fear. I still think there is huge stigma surrounding mental ill health, asking for help, disclosing for help. I still think there's discrepancies in mental health literacy, so therefore understanding your symptoms, patterns within yourself, and therefore leading to an inability to ask for help and identify what help you might need. Goes without saying, Matt's already alluded to this, discrepancies in financial support and actual access kind of around the globe to health support and specifically within that mental health support, and then the mental health literacy within that support and the understandings and the treatments available to individuals. I also think, and again, this comes back to discrepancy in understanding mental health literacy, and perhaps also linked to the stigma that still exists. There's a lack of understanding of what support and resources are available massively amongst communities. I mean, I even see this if I look at the organisation in which I operate in, and that's a teeny tiny part of kind of the global picture, but there are huge discrepancies in people understanding what resources we have available. And again, it comes back to that need for signposting and constant communication and really clear and articulate signposting, because we always say, mental health support is not going to be utilised until you're in a position where you recognise you need it. And so it becomes like a self-fulfilling prophecy. And that's why it's such a huge, huge challenge. But I think the kind of clear ones for me are the financial discrepancies. Stigma is a huge one, lack of understanding, and obviously discrepancies in the actual support and treatments that are available.
Just to follow on from that, do you think in a generality that employers do enough in terms of both hiring people with mental health issues and supporting them once they're in work? Or is there something more we could be thinking about or doing?
I think change has been made, positive change has been made, but more has to be done. I think businesses need to better understand, and I think this comes back to Matt's point around the importance of research. We need the data points to understand what are the challenges of the current working population, and therefore what are the interventions that we need to put in place? Because I think it's widely understood that we need to better support people in work on their mental health journeys at all points and parts of their career, whether they're just entering the workplace for the first time or if they're a really seasoned individual within their respective organisation. But I think the needs and the challenges that we are all experiencing are changing daily. I mean, you look at the world in which we're operating in, and Matt's again already alluded to this, you know, the social justice movements are so significant on individuals' health and well-being. We are living through a global pandemic. Sadly, you know, it looks like we are still in the eye of the storm. All of our respective mental health are going to be affected. If not now, it might be next week, it might be next month, it might be next year. And organisations have to stay alert to the challenges that are ongoing and are likely going to evolve, because until we understand what those needs and desires are, we aren't going to be able to put the correct interventions in place to create sustainable change. Sorry, I know we've got an arm raised.
No, Shubhangi, you want to come in on this?
Oh no, I was happy to let you finish. Sorry, it's just a thought I had.
No.
You go.
Yeah. No, I quite like this idea of, you know, actually understanding what is happening and using information, using actual grounded responses to create change and create improved access to services. I suppose some of the stuff through my time in choice support and just generally what follows from having a mental illness and being disabled and in the workplace, in hospital. I find that something that I've had to do as an individual, which has been really difficult, but I hope that, you know, people can do on a more systematic level, is not just educate people about mental health in this loose sense, but about mental illness. Like what I live with is quite rare, and equally, like neurodivergence is quite common. But because there's such a spectrum of experience, I have actually had to go to my occupational health doctors, or, you know, go to doctors and had to explain to them from research I have done a condition that I live with. And, you know, it's all well and good to say, you know, oh yeah, we know that depression exists, we know that anxiety exists, we know it affects marginalized people. But what about, you know, actually acknowledging that certain professions, for example, have higher rates of people with eating disorders, and actually understanding what effects eating disorders have on your staff, or, you know, PhD, whatever, like actual tangible supports, even for non-classified illness like burnout that is beyond, you know, oh, you have 2 confidential sessions. Encouraging people to take time off for mental illness as much as they would for a broken bone. I mean, I think there's certainly points where the working cultures around COVID, like understandably, had gotten so bad in healthcare around the country, where, you know, there were definitely junior doctors, probably including myself, who felt like it would probably be easier to be run over by a bus to come into hospital to take time off than just to be able to take some time for your mental health. And I mean, you know, this is not to catastrophize, this is simply a practical outcome of being in very stressful environments where, for understandable reasons for us, but possibly not for other employees in other sectors, people don't actually have the time or energy or knowledge to really respect what taking a mental health day means. And I think for that, naming not just mental health, but mental illness is really important, and facilitating a good open disclosure environment or a good support environment is really important.
And just to follow on from that, why do you think there's such a discrepancy in the way we think about physical illness and mental illness, and why is it so stigmatized? Is it because it's invisible? Is it because of fear? What do you think is the reason?
So I have to say, I know I can only say this from a healthcare perspective, but even, you know, I've now worked medical jobs and worked in a surgical job. And yes, mental illness affects people regardless of, you know, whether you've been hit by a truck or whatever you come in with, like an infection or something. Your mental health is separate, but I suppose this is kind of the issue. I don't necessarily think it's stigma so much as a lack of education. And when you have this pervasive lack of education in society, even with healthcare professionals, you just start seeing it as, you know, the other thing, or it's the other thing that those other doctors manage. You know, it's not a general medical issue or surgical issue, it's just that other thing. And when you couple that othering with the deep and profound lack of public servicing that we have across all sectors to support formalized mental illness poor mental health on a public and freely accessible basis, what you get is, it's not only this other thing, it's somehow less real, because the only way to deal with it is, oh, you go to a little charity somewhere, or, oh, you went to a little counseling session, that's good for you. That's not, real medicine. It's not a real problem because you don't go see a doctor. Because, for example, I only speak for myself, but I had an 18-month-long depressive episode. The only way I was able to access public health care was 3 weeks after my 18-month depressive episode had ended. So I went in and they were like, oh, but you're grand now. It's appalling. So not only are you othering it from, actual medical professionals' perception, but also the public's perception of what health and healthcare is. You're literally you have no resources to provide that healthcare unless somebody is at death's door, at which point it is plenty of paces too late to establish early and regular, interventions. So yeah, there's this coupling of limited understanding of it, let's say, particularly of more challenging or, I suppose, less commonly heard of mental health issues and mental illnesses, plus the lack of resourcing. So how are you going to normalize something when really, in a very sincere sense, the only thing you can do for your mental health is take a day of cry at home? You can't go to a doctor because they won't do anything. You can't access one. So it just makes it feel, like it is less real, like you're trying less hard to get care for it, or, like you're not trying at all, when realistically, that on the one hand, you might get an appointment 18 months later with a professional who is massively stigmatizing or poorly resourced or poorly educated on your illness. When that's the flip side, then really all you can do is stay home and take a day off, which seems less valid to the outside eye.
Yeah, unless there's a diagnosis and there's a prescription and so on. Yeah.
It's a vicious circle, and it really breeds its own additional features of poor mental health on a massive scale.
Yeah. Thank you. Ross, can we turn to you sort of in terms of SpunOut and the aids you give? Is there any signposting you can do, or what you recommend if someone presents to you with issues, or what can you do in that situation?
Yeah, I guess because SpunOut is for young people, by young people, it's very much had its finger on the pulse of all the issues that affect young people, and mental health has for a very long time been one of the key and core issues that they worked on. So SpunOut has done a lot of work in terms of amplifying the voices of young people that have had experience with mental health issues. And that's to kind of, I guess, to break down the barriers that you're alone in what you're experiencing, or that what you're experiencing isn't valid, or that there isn't opportunities for, you to make positive progress with whatever the issue is. So there's that kind of awareness piece, and I guess peer, I guess raising awareness that your peers can experience similar issues, but then that's fine once you're aware of that, but you also need to back that up with support. So there's a really, really great service that SpunOut is connected to, called 50808, which is a 24-hour free text. I think it was actually shared in the chat box with everyone here, but it's a 24/7 volunteer operated chat service, instant texting service, and that is able to provide mental health supports through to crisis intervention supports. So really you're able to enter it at any point, at any stage in your mental health experience. And if you do need some kind of crisis intervention, that is available. If, your issue maybe needs a little bit more attention beyond kind of what a text can provide, then there are services that can be signposted. And equally on the youth information chat service, because it's a one-to-one conversation that you're able to have with expertly trained youth info officers, they can talk through the different circumstances. And, no matter what kind of issue somebody presents to us with, if they're looking for help with their CV, and then it turns out that they're really stressed and burdened by the fact they don't have a job, and, as soon as there's a sense that there's a connection to somebody's mental health or a potential mental health issue, services are signposted to that young person. So it's just, I suppose it's really, really important to be conscious that while the dots maybe aren't connected in terms of services and supports that are offered at a state level, it's really important wherever we can to connect those dots and to highlight that, I know you're talking to me about X issue, but mental health or issues can also arise, worries can also arise, stress, anxiety. And Shubhangi is absolutely right in saying that there is also a need for greater awareness around maybe the more enduring and acute end of the spectrum for mental health issues. And equally that there's signposting that happens for issues on that end of the spectrum.
Great, thank you, thanks. And it's good to know the supports are there. If not joined up, but as much as can be. But that's a bigger systemic problem that we can't tackle today, unfortunately. But there are huge issues in the health system, especially around mental health supports, and people coming to them too late or in crisis mode, as Shubhangi pointed out as well, which is just not good enough. Matt, do you have any thoughts on this? I know you're coming from a different context, but in the broader, what needs to be done to help marginalized people and the commonalities between the different groups, how we can help them?
Yeah, I think sort of the lens at which I sort of, bring the dynamic to this conversation is think about what organizations, what employers can do, to really support around sort of mental health. And I think, going back to the points I made earlier about, what have we learned from this, around disproportionality of impact, technology, etc. But I think, we've got to be talking about this as organizations. It's got to come from leaders. They're the ones that have the power to lead the conversations, to normalize the conversations. I think the second thing that organizations then need to do is to think about what are the actions, what are the responsibilities, what are the things that we can do, and the elements that people can be accountable for in improving the situation within our organizations. And I think we need to think about this point around role modeling and storytelling. Very powerful tools in which to make people feel more comfortable talking about mental health. I've spoken to quite a few sort of CEOs over the last sort of couple of months, and there's actually very few that do talk about mental health as a thing. The ones that I have seen sort of do it have really, used the power of their own experience and storytelling. And what we're seeing now is a direct impact in terms of more people accessing the support systems that organizations have in place. People are more comfortable now. So talking, actioning, and then of course we get sort of the results. But I do believe role modeling and storytelling around this is something that I think is probably one of the biggest things that organizations can do to improve.
Yeah, thank you. Well, that's interesting. If you see it does tear down stigma. It does make it more acceptable to share your own story. So I think that is very important, especially in the workplace. And just while I'm talking to you, what are issues in the workplace and what can companies do about it? What sort of particular aspects of working or getting into work cause issues or triggers for mental illness, and what can companies do to try and tackle that from the very get-go when someone presents?
Well, I think, starting any new job is always a period of anxiety. And one of the things that I always say quite a lot is that, we all have a mental health. It depends on what factors and what things we're going through as to whether we're at the end of one spectrum, which is poor mental health, or whether at the other end, which is a good mental health. So for me, changing a job, and they always say, don't they, that the most stressful things in life, changing jobs, changing a relationship, buying a new house, moving house, are the most stressful things. So I think, organizations do need to think about, even before the employee starts, how are we engaging them? Are we aware of their concerns? I think the role of the line manager, who's hired them, those conversations to me should be happening at the latter stage of an interview process or after an offer has been accepted. Because the anxiety someone might experience before joining an organization could be great. And if we can diminish that a little bit and be aware of, what they're concerned about prior to them joining, we've got an opportunity to preempt and to reduce the anxieties people sort of might be feeling. And I think just a second point, what I see play out in the financial services industry, and I'm sure Alexis will agree, and she's got a lot more experience in working with other industries than I have, but financial services is a very how can I say, very high performance environment. It's a very demanding environment. And if you look at the stigma, around mental health being as a weakness, which is, I still find ridiculous in this day and age, but it just means that the culture is that we're less likely to talk about it. So again, I think that the role of leadership in role modeling these conversations and normalizing these conversations, just like, I know this is your next question, just like Gen Z and millennials have now normalized mental health in the main, I think leadership, within organizations have really got to accelerate progress around these conversations and these stories. And that really is my big message for today. Talk about it.
Great. Alexis, is there any additional piece you'd want to add to that?
I'd reiterate everything that Matt said. And I think we shouldn't underestimate the impact of this extended period of remote working and what the future of hybrid working looks like, because I think we can talk about mental health, we've got to remove the stigma, eliminate the stigma, but we're not really talking to one another in the way that we were before, because everything's gone virtual. So if you look at the workplace, we have lost contact in the way in which our organizations and our relationships were built historically, and we've got to redefine and relearn how we are getting to know one another, how we're building relationships with one another, and importantly, how we're maintaining those relationships with one another. And so we've got to work really, really hard at creating relationships in a way that we haven't done before. And I think that's just going to add to the complexities of breaking down the stigma which does exist surrounding mental health. So I don't have an answer, but I think we shouldn't underestimate the impact of remote working and the potentials of hybrid working in creating strong relationships, trust-based relationships, where we feel able and empowered to share our mental health status and challenges and issues. And I think it's just a point of consideration as we kind of move into this new way of life, new way of working. And you spoke about kind of onboarding new recruits and, Gen Z entering the workplace. There is a huge opportunity for us to redefine how we are building relationships and how we are maintaining relationships in a healthy way, where we're really talking to one another about how we're feeling and meaning it. But I think there's more to be done.
Yeah, so we all need that support network around us, going back to comments made earlier in the day and the difference that makes. I just at this point, if anyone has any questions, please pop them in the chat. I know there's some information in the chat, support information, but if you have any questions, because I've just realized we're very much nearing the time to call a halt to this discussion, and we've got lots more to say, but if you have any particular queries for the panel, please do pop them in. We touched on Gen Z and millennials and those titles. I hate those titles, but anyway, they are what they are. In terms of them encouraging positive mental health and well-being, they're very proactive and really engaged in these areas. I was just wondering, maybe Ross, you might have some views on why they've been so instrumental in bringing about this change and what the impact that'll be.
Yeah, to be totally honest, I actually don't know what the age ranges are for the different gens.
Younger than me.
And I don't know what that says about me and my gen, that I don't care about gens, but there definitely has been a shift. And I guess there's loads of different things, there is a shift in terms of people maybe connecting in different ways than they used to, that there is a sense of confronting things like stigma and discrimination that usually, in years gone by had been allowed to happen or hadn't been confronted. And it's really great to see that there is more discussion about issues like mental health and LGBTI identities. I suppose the thing that's important to remember is that while we talk about it more, it can encourage people to come forward and to access services that they need, which is phenomenal and fantastic. But it's absolutely essential that those services and supports are resourced and are there, and that those services and supports are trained in the different nuances that different vulnerable groups have, that they have an awareness of equality, diversity, inclusion, equity, the rest of it. I think that it's really important that services and supports are, in a position to truly help people and to not kind of homogenize a group that, you know, here's Ross, he's gay and he has a mental health issue. Yeah, that's grand. I'll treat him like every other gay person with a mental health issue that's come in. Not to kind of be so reductive as to just make the assumption that because you have an identity or identities, that there is a set way to treat or deal with you. I think it's important to always remember that somebody is an individual and that they have their own weirdness and wonderfulness like everyone else, and that should be the approach, as opposed to kind of a siloed way of thinking about people. And there can also be, you know, with the increase in discussion and appreciation for mental health, there can also be some drawbacks in terms of like an everyone out. You know, if you do have an identity around or an LGBT identity that you should be out, you know, that's what you do. You have to come out, and that's not the case for everyone. And the same with mental health, that, you know, there is this, I call it kind of the LinkedIn effect, but, you know, there's this like, you know, you should be out and proud and posting about it and the rest, but, you know, that's in a lot of ways, it's a privileged position to be in. And that privilege isn't available to a lot of people, you know, in terms of their own family dynamics, in terms of their own safety and security. And I think Shubhangi had mentioned it earlier about particularly trans people and the greater likelihood that they have of experiencing negative things because of their identities. So, you know, it's to be conscious that there's a goodness and a badness in terms of the increase in conversation, that there is possibly greater awareness of supports that are available to people, and, you know, that it's important that those supports continue to be there for them.
Yeah, thank you. Thank you. It's a really good point about the individual need, and you can't click everyone with the same box and label and so on. Shubhangi, you'd like to come in, please.
Yeah, I think that's a really, really good point about not, I suppose, typecasting. But I suppose on the flip side, I guess, you know, being a person who's trans, being a person who's a person of color, etc. I think one of the things that highlighted to me was how important language is, and how important, like, you know, we talk about creating spaces to have conversations, but we actually need to create, you know, a language of shared understanding, but also like literally the understanding that, you know, mental health in different languages and different cultures means very different things. And we need to figure out how to trade on the same understanding, even when experiences and the framing of them are so different. I mean, I've worked with people where you could ask them about their mental health, and it literally takes 2 hours with a translator, and you realize there's literally no term or no understanding of the concept of mental health. The closest thing you'll get to is, you know, spiritual well-being. That's literally the only close reference to mental health that exists. And they can say, you know, I feel spiritually ill, or I feel spiritually hurt. And knowing that, you know, there are those differences in language, there's differences in translation and things that are lost in translation, making sure that those conversations equally are, you know, accessible for people with disabilities and difficulties of communication, or I suppose people, for example, in disabled communities who would like to refer to their mental health in the context of identity first language or person first language, some understanding of that mutual trading ground of communication in good faith is really important. And at the end of the day, bringing that down to the very level of, you know, the person across from me, how would they like to be referred now? Understanding, again, as I said before, that reference might change, their identity or their pronouns might change. You know, the way they describe or frame their mental health between two conversations might not be the same when they learn more things about themselves. I think that's really important. An appreciation for how language and culture and enhancing communication in terms of communication aids for people who have difficulties with that, how that can really play into, you know, going beyond just saying we've made a space and it's open now. Like really actually understanding what people are trying to tell you is really important.
Yeah, there is no easy fix for any of these issues, but it is a question of understanding them more and being open and trying to put yourself in someone else's shoes, whatever size shoes they may be and however different they may be. And, you know, trying to appreciate it from the individual's point of view. I think that's all really important, and language is the key one in that, because it's all changing in our society for the better, where we have difference, we have diversity, and it's not one size fits all. I think that's really important to remember, that it's not just a generic approach. Susan O'Riordan has just come in and said, let's all start with, what can I do? What do you need me to do to help you to the best that you can do? And as managers and organizations, we have a duty of care to our employees in the workplace. The home is now often the workplace. We can all help by having the conversation, a phone call to all staff about how people actually are, not just about their work. If everyone brings their human side to work, not just work persona. And I think that's a very relevant point. You know, it's not just about the work. The work in itself can be a societal safety net for a lot of people, and it certainly forms a community that we work towards. So there has to be more to it than just the day-to-day data and, you know, exercise or whatever you do in your day-to-day work. It has to be about having those bonds and those safety nets. Shubhangi?
I'm really sorry, just a tiny piece on that. You very rightly highlighted that the home is now the workplace, and a good bit around mental health, I suppose, and careers is realizing, obviously, you know, that you're reaching out, but also knowing, and you know, that there's legal work going on around this at the moment, and the right to log off, and the right to privacy, and the right to just a clear mind, and not letting the home become only the workplace. And I think absolutely, as any employer, as any coworker, sometimes that should be a key factor in decisions, realizing that people work better and are just better in themselves when they have a break, when they have, you know, time to just think about something completely different.
Yeah, absolutely. And it's something we all have to take on board, and also to have flexibility in the workplace. If people need to step away from the screen for a while, they don't have to ask permission and see it as a big deal, but there should be flexibility in terms of line managers and so on to give them that space, because it's not going to hurt the workplace. It's probably going to help it. We've gone way over time, which is great. I'm delighted. It was such a good talk. Just one final question to all the panel. If there's any final words of advice you can give to help people impacted by mental ill health, I'll go to Matt first, if that's okay.
Yeah, I'm going to interpret the question from an organisational lens, if I may, just because of the lens that I'm bringing today. But I think 3 points for me, you know, make mental health clear and visible. Secondly, use social media and technology to help increase awareness. And 3, do it consistently.
That was very succinct. Thank you very much for that, Matt. Good points, really strong points. Ross, if you'd like to add to that.
Yeah, I guess so definitely having an awareness of the different supports and services that are there, or the spaces that you can go to in order to get closer to those services and supports, like SpunOut, 50808 and Youth Information Chat. I suppose two really important things are to remember that being held and being heard make a massive difference. You know, listening to people, trying to hold that safe space for them and bringing them to wherever they need to go, you know, and there's huge potential if somebody is listened to, if they are, you know, better informed, if they're empowered to kind of drive change in their own lives. And there's a lot of great organizations and great people, you know, these things happen around kitchen tables and coffee shops and the rest of it, that there really is a lot of potential in the really small things, the really free things, I guess. You know, listening doesn't cost much, and trying to support somebody doesn't cost too much. I'm saying that not as somebody who runs an organization, I'm sure.
No, thank you. And it is true. We have to give a listening ear, and there's no cost, and it can have a huge impact. It's very true. Alexis, any words for us?
I would reiterate what's already been said, and I just think remember the importance of contact, especially in this period of isolation. If you are experiencing mental ill health, do reach out. Remember the importance of contact. As it's already been alluded to, there are plenty of resources and supports out there. I think we shouldn't underestimate the impact that our mental health champions and allies can have. And so a word to us all to remain kind of vigilant and supportive, and yeah, to remain listening and proactive in supporting everyone. And yeah, just to maintain that contact, because I think we aren't yet quite aware of the impact of the last 18 to 20 months, and I suspect it might go on for a while longer.
I really hope you're wrong. I wish, but here's hoping. And Shubhangi, if we come to you now. Can't hear you, you're on mute.
There was always going to be the one time I was on mute, of course. I really hope you're wrong. I'm going to be working in the ICU after the winter, well, after the new year, so extremely hope you're wrong on that one. But it's a very reasonable outlook. I suppose from my perspective, I just want to reiterate that nobody is above mental ill health, and you know, it doesn't have to be codified for it to be challenging. And we talk a lot about, you know, like reach out, talk to somebody. If you feel like you have people in your life who do require additional mental health support, that can become too much. Listening doesn't cost too much until it does, because you've kept on telling yourself that it's fine, you know, I'm not unwell, they are, they need the care right now. Just really realizing that every one of us, you know, by virtue of us being human and being people, every one of us is in multiple reciprocal relationships of care, where you share care and you give it and you receive it when you need the comfort. If you are feeling, you know, as somebody who's a care provider in whatever sense, especially in an informal sense, if you are feeling that level of overwhelm, like there's absolutely no harm for you to go and try seek formal support of any kind yourself. I think that's actually highly important. Being that person who listens is amazing, but that shouldn't ever preclude you from being the person who's listened to, if that's what you need. And then I suppose on the organizational sense, I think I would just stress, as like interacting in the world, not just as individuals, but as employees and employers, open communication and awareness and all of that. I mean, I hope to move towards a world where that is taken as read. I frankly do not understand and do not know how many more, you know, World Mental Health Days I could cope with, or World Mental Health Awareness Days I could cope with, because I am pretty aware of how difficult it can be for myself, for my colleagues, etc. But moving to a space where we consistently demand actual supports rather than just awareness from employers, supports much the same as would be available for physical health services, or even, you know, the time away to deal with your own mental health the same way as physical health services, without it being seen as a moral failing or a personal failing or a value judgment. I think that is key when we interact in the world as employees and employers.
Absolutely, there has to be equity between mental and physical health. It does not make sense when one is so pervasive and affects so many people that it is not recognized in the same context or treated in the same context. It makes literally no sense to me. I think it's a really strong point to wrap up on. I mean, there has to be equity of treatment, of a lack of stigma, of embracing people with all their quirks and differences and how they present and how that affects them in the day-to-day and how that affects them as they present and work and in or not working or whatever it may be in their daily lives. So I just really like to thank the panel, Matt, Alexis, Ross, Shubhangi. It's been a really interesting conversation. I hope to pick up with you all, because I just think there's so much to, and I have self-interest at heart and a bias, but I just think it's been really fascinating and practical and illuminating. thank you all. And there's been comments coming through. I hope you get a chance to look at them as well. And thank you also to the people who joined us this morning. If you've any last questions, now's your chance. Otherwise, we'll let the panelists go about their work. And thank you all for your time. Take care.